Ecological medicine is all about asking the question, why? It's all about looking for root causes of diseases.
Why do people get ill? Is there anything we can do to prevent it?
The sad thing is now that we reckon that there are over 1 million patients with diabetes who are undiagnosed now.
What we do is we think about it in an integrated fashion. So we bring in all the different strands: allergy, environment, nutrition.
But ecological medicine is ecological in another and even more fundamental way, which is it sees the human body in the wider context of planet Earth.
Where we have our own ecosystem, then that is a reflection of a larger ecosystem. So you're looking at the ecosystems of the communities around us.
We are surrounded by chronic degenerative diseases. Conditions that were rare a century ago have now become common. Cancer, Alzheimer's, type 2 diabetes, mental health issues, heart disease. They're affecting people we know at younger and younger ages. It doesn't have to be like this. Alzheimer's is not a normal part of aging. Heart attacks aren't simply a result of high cholesterol. And type 2 diabetes isn't inevitable.
So it's increasingly apparent that the lack of micronutrients in our food is leading to a raft of chronic health disorders.
One of my most hated pesticides is glyphosate. Wonderful book by Stephanie Senath, A Toxic Legacy. 54% of the microbiome is sensitive to glyphosate. 54% can be destroyed by eating inorganic foods.
For over 40 years, practitioners at BSEM have been taking a different approach, one that looks at the root causes of disease, not just the symptoms. This systems-based ecological method is showing the way forward, and after decades of hard work, these principles are being increasingly recognised within mainstream medicine.
Conventional medicine, just by the nature of the system, clinicians are specialists, and at that then subspecialists. And it has its purpose, in terms of efficiency, and people know, okay, they become experts in one particular field, but in doing that, you miss the whole picture.
I think being a member of the BSEM has enabled me to take my practice to a whole new level.
Every time I've gone to a meeting, I've come back buzzing, I've learnt new things, I want to try that with my patients.
And then at some point I decided, hey, hang on, let's just look up BSEM, because I think there's something there. I think there's going to be something in the membership that I could benefit from. And really there was this mentorship program that gave me a lot of support and confidence with practicing this method.
Recently I learned much more about treatment approaches that I don't know about, but want to know of, because they would be very useful for me, for some of my patients, if I need to refer them on.
Learning that simple, natural methods, not using drugs, could actually make people better.
Well, just to say how very appreciative I am of the BSEM. It's been going now for 40 years and is going from strength to strength. Amazing team. Yeah. Amazing members. There is an opportunity which people are recognising to, expand their work beyond the purely sort of allopathic approach. We are noticing that. We are having far more members join now than ever before.
Join us as we celebrate 40 years of ecological medicine, a milestone that shows another future is possible, one where we can transform health together.